Good afternoon, everybody. Thank you so much for joining us. This is Amanda Pierce-Kelly. I'm the National Advocacy Director at NAC. It is 2 past, and so we want to be respectful of everybody's time and go ahead and get started. We're going to begin by going through some housekeeping just so that everybody can make sure that they see the slides and are able to ask questions as they come in. Just a reminder, this is the March Policy and Advocacy webinar. We'll be walking through the latest developments for health centers on the Hill, the challenges, the opportunities, our priorities, our messaging, and our asks. There is very important information for folks that are going to be joining us next week for the Policy and Issues Forum. This is a really wonderful way to get a leg up on a lot of the information you're going to be receiving during the conference. And for folks that are going to be staying home, there are some really specific activities that we're going to be looking to you to help us with to make sure that the health center message is being delivered clearly and forcefully from back home, and again, to reinforce the folks that are going to be in Washington next week. So with that, let's go ahead and dive in, and we'll get here to the next slide. Again, because of the number of folks that we experience as a part of these webinars, and the participation level has just been fantastic. But one of the things that means is that the best way for you to access the audio is via your computer. There's a limited number of phone lines available, and so we ask that everyone do their best to connect to the audio for the webinar today using your computer. And so this is a slide that helps you understand how to do that. Hopefully you can hear me already, but if not, this should be your directive to be able to plug into that audio. Just so folks know, the webinar is going to be recorded. It's already being recorded, and we will go ahead and post that on the Health Center Advocacy Network website. You can see the web address there. Typically, it takes a day or so to get those linked up and up on the website, so be patient with us, but we'll do our best to turn that around as quickly as we can. The other place you'll always see us put out the recordings and the audio for the webinars that we do is via the Washington Update, which we send out weekly. So you'll have a couple different spots to access the slides and the audio coming out of today's discussion if ever you need it, and or if you want to share it with your own network of advocates and colleagues. Another important piece here, if you have questions throughout the webinar, you can go ahead and enter it into the chat box. You can see there in the bottom right-hand corner, everyone should have access to a chat box. That's the best way to communicate with us as we're going through the presentation. If you have questions, if you have comments, we may take those up as they come. We will certainly spend some time at the end walking through as many questions as we can get to. And if for some reason we don't get to your question, we will always follow up with you coming out of the webinar to make sure that you have answers and resources and access to the information that you're looking for. So again, today, boy, there's a lot to get through, and a lot has changed just in the last month since we did our previous policy and advocacy webinar. We're going to be providing the latest updates, again, in terms of the challenges and opportunities for health centers this year, including the American Health Care Act, the AHCA. That is the House bill that is quickly moving and due for a vote, which we'll talk more about in future slides, but due for a vote potentially in the next couple of days. We want to make sure that you understand what's happening in Washington, the latest updates, and the potential impacts for health centers and our patients. We will walk through our priority issues and strategy, our key asks. Again, whether you're attending the P&I, the Policy and Issues Forum next week, or you're staying at home, everyone has a really important role in our advocacy, and your voice is going to be so important next week in particular. So we'll walk through, again, the priorities and the strategy there, and then we'll walk through the advocacy update, those key action steps that you can take today, next week, and over the course of the next several weeks to make sure that we're delivering the health center message loud and clear. Now, lastly, before we even dive in on the details, I want everyone to see and mark this date. On March 30th, for folks that are going to be home and not attending the Policy and Issues Forum next week, we're going to be having a call-in day, a national call-in day that will coincide with Hill Day during the Policy and Issues Forum. So again, on March 30th, next week, all day we will be having a congressional call-in day. You can see the dial-in number there down across the bottom. You will also be able to access script and talking points on the Health Center Advocacy Network website. There's the address. I would just encourage everybody to, again, mark the date, March 30th, for our National Call-In Day. For those of you that are going to be in Washington storming the Hill as part of Hill Day, we're excited to have you in town, and we'll be looking to you to deliver that message in person. But everyone back home has a role to play that day as well. So again, please mark your calendar for March 30th. We will get you more information up to the minute around what the messaging is going to be. We want to make sure that the message we deliver is most relevant, most effective, and most powerful. So stay tuned for more information on that front coming very soon. So with that, I am very happy to turn it over to John Sawyer, our Director for Federal Affairs, and his team. From there, we'll walk through the advocacy piece, which will be headed up by my fantastic team, Alex Harris, Elizabeth Kwasnick, and Dorian Wanzer. So with that, we'll get started on the policy side and jump into some advocacy from there. John?
Thanks, Amanda, and thanks to everyone who's on the phone today. Apologies in advance if you hear a little scratchiness in my voice or a little coughing. Trying to get over a little something here before we really get into things later this week and early next. On that note, it is an incredibly busy time here in Washington, and if you've been following the news, you know that healthcare is really right at the center of all of the current debates right now. And so we have a real opportunity in the coming days and the coming weeks to really influence the direction moving forward, to really reiterate the Health Center agenda, and to make a difference, I think, in the middle of an extremely important debate that's happening here in the nation's capital, and I think will continue on for months and months, if not years and years. So I want to start by sort of talking through the latest developments as far as what's known as the American Health Care Act. That is the House Republican plan in the frame of repealing and replacing the Affordable Care Act. I want to talk about some of the details of what was introduced. We'll talk about some of the most recent changes that were made to the bill as recently as last night. We'll talk about some of the implications for health centers, and then what we're going to do in terms of reaction to the bill and where it stands in the process. The bill was introduced earlier in March, on March 6th. Feels like years ago now, but with several sort of main provisions making it up. It would undo some of the main core elements of the Affordable Care Act, including the individual mandate, by reducing the penalty for the mandate down to zero. It would change the way that subsidies are based for private insurance, for people to buy private insurance, taking that from an income-based approach to an age-based subsidy. It would eliminate almost all, or if not all, the taxes that were included in the Affordable Care Act starting in 2018, which would significantly reduce the amount of resources that they have to put towards any potential replace plan. And I think probably most affecting of health centers and our patients, two provisions that we're very concerned about regarding Medicaid. So first, the bill would begin to roll back the Medicaid expansion starting in 2020. After 2020, states would no longer be able to enroll people in the expansion population at that enhanced federal match rate. It would also make a fundamental underlying change to the structure of Medicaid itself, changing the program from one where federal and state contributions are matched in an ongoing percentage to one where the federal contribution is capped, regardless of how fast healthcare costs grow, whether there's a public health outbreak, an expensive drug, other things that could drive up costs. The states would be left really holding most of the risk in the Medicaid program over time. It does include resources to states in a number of ways. One, to stabilize the insurance markets. Largely, it's anticipated that those resources would go towards things like high-risk pools. It also directs some money, a much smaller amount of money, toward non-expansion states to try and sort of make up the difference between non-expansion and expansion states through about $2 billion a year allocated for increased payments to safety net providers, a very small amount of money. And it would change the way that the ACA worked in terms of what's called age rating, the difference between how much you can charge a younger person versus an older person would change that ratio from the ACA's 3-to-1 to a new ratio of 5-to-1, basically letting insurers charge older people more for coverage. One of the turning points in this debate thus far has been when the Congressional Budget Office released last week its score of the legislation, which is essentially its analysis of how much the legislation will cost, how much it's projected to save, and what impact it's projected to have on coverage. And you can see some of the really dramatic numbers there. 14 million people projected to lose coverage in the first year, 26 million by 2026, an incredibly large reduction to Medicaid of $880 billion over the first 10 years, as well as some significant deficit reduction in the form of $337 billion, lower deficits over that 10-year period. I want to then just update on some of the most recent changes that have been made to the bill in what's called a manager's amendment. Again, all along through this process, our commitment to you is to give you the latest information so that your advocacy is as informed as it possibly can be. And Congress is going to continue making changes to this bill, we anticipate, as it moves through the process. Some of the biggest changes that were made in what was reintroduced last night are that states now can either use the per capita cap system in Medicaid, which was described earlier, which basically caps the Medicaid, the federal Medicaid contribution based on different population types, or they can choose an optional block grant, where the cap would be instituted at a statewide level, and they would have some additional flexibility under that. I think we have some real concerns with both approaches, but especially with the block grant approach, given that under that flexibility, there are certain health center protections that could be waived by a block grant. They also will give states the option to add a work requirement to Medicaid. This is something that's been proposed in a number of waivers that have come from states, a number of proposals coming from states about how to change their Medicaid programs. Up till now, the Obama administration had not agreed to allow states to do a work requirement. This would allow for that to happen under the law. It's also something that many people have anticipated the Trump administration would sign off on anyway. It would set up a fund to provide additional tax credits to elderly folks in response to those criticisms that the bill did not do enough as originally introduced to support older folks, and it would move up the year that the ACA taxes would begin being rolled back. A couple of things that were rumored to be included in this new version but aren't. There was a push to move up the date of repealing the Medicaid expansion. That remains at the year 2020. And there has been all throughout the process a real push to change many of the insurance regulations that the ACA put in place. That's not done in this bill. We don't anticipate it will be done in the Senate bill, and that is largely because, as we've talked before, there are Senate procedural reasons that they can't change underlying policy in a bill like this, called a reconciliation bill. They can only change things a little bit through, they can only change things that have to do directly with the impact on the budget. So we want to focus in a little bit on what the AHCA, if implemented as it is today, and again, we do expect things to change substantially through the process. If it were implemented today, what would be the effect on health centers? I want to start by noting that NAC has expressed major concerns with the bill, both in the form of a public statement, conversations directly with policymakers, as well as the action alert that is currently on hcadvocacy.org. And hopefully most of you got that directly in your email if you're signed up as an advocate, or you can go to our website to take action on that. Obviously, the coverage reductions in the bill, especially those in Medicaid, would have a harmful effect on health center patients. We estimate that just owing to the rollback of the expansion alone, Some 3 million health center patients have gained coverage due to the expansion, and therefore that coverage would be at risk for those populations. The per capita cap, we are concerned overall would lead to reductions in eligibility, benefits, and potentially to payments for providers under the Medicaid system, and this would be even more potentially drastic under a block grant. It's important to note that the bill as introduced does not explicitly change the FQHC prospective payment system. This is for a couple of reasons. One, the bill doesn't go into a whole lot of policy-related flexibility because, again, of those procedural constraints. But despite a push from the Medicaid directors and other actors towards changes to the FQHC PPS, that remains intact in the bill. The bill, as we anticipated and have spoken about before, does include a $422 million increase for health center funding in the current fiscal year 17. This is directly related to the provisions in the bill calling for the defunding of Planned Parenthood from a variety of federal sources for 1 year. What's important to note, especially about this as we go into some of the issues that we'll be focused on in the P&I, is this is not in any way, shape, or form a fix to the health center funding cliff. In fact, by increasing the number in FY17, it actually makes the cliff even higher, and we are very focused on making sure that the cliff be addressed as soon as possible this year. But I know many folks saw those dollars included, had a lot of questions about those, but it is not in any way a fix to the health center funding cliff. The bill would also eliminate the Prevention and Public Health Fund, which has been, over the years, an important source of funding for CDC and other public health programs. So this is a slide that we are keeping updated as the process moves forward. As you know, the House Budget Committee and the Senate Budget Committee did their resolutions earlier in the year. That's what set off this whole process. Now the bill has been voted on in 3 House committees. You can see the tightening margins there. In the first 2 committees, the votes were party line votes of 23 to 16 and 31 to 23. In the Budget Committee, we saw a much tighter vote with 3 conservative Republicans voting no, and essentially the bill passed the Budget Committee by only 1 vote. What we are anticipating as of today is a House floor vote this Thursday evening, the 23rd, which is a symbolic date for the leadership because it is the 7-year anniversary of the signing of the ACA. What we are hearing as of right now is that the vote is very, very, very close, and the leadership does not necessarily have in hand all of the votes it needs to pass this bill. There are major concerns, again, by industry groups like NAC, by other groups, as well as by conservative groups, liberal groups, and kind of the whole gambit. But the pressure on House Republicans to vote for passage from their leadership, from President Trump, is very strong. And so it is important, I think, that folks take the action that's on the website and reach out to us in terms of specific members. If you have conversations with other members, we want to work with you to talk about who's vulnerable, who's potentially going to change their vote, who still needs to hear from us going forward. Moving ahead beyond the House, we're not positive this will pass the House this week, but most indications are that it will. The picture in the Senate is much murkier. I think that, what we know for sure is that a very significant number of senators are on record either outright opposing the bill or with big concerns about the bill. And so, we anticipate that there will be some major changes made to the bill, if not a whole slowdown over the bill in general in the Senate. That being said, I think there is major momentum by Leader McConnell and the President to continue moving this through the process very quickly. And so this could be beginning to be debated on the Senate floor as early as next week when all of our folks are in town. The pressure, substantial pressure, is to finish the process before the Easter recess, which is at the end of the week after next. And, you know, the concern, I think, among Republican leaders is that if they are not able to pass something before Easter, it will be very difficult to come back to town after a 2-week break and push something through. So with that, I want to turn it over to Alex to sort of reinforce what we've been talking about in terms of advocacy tips.
Thanks, John. And yeah, so as John said, it's really important that you guys take a few minutes and just plug into our website to contact your members of Congress about this bill. If you go to hcadvocacy.org/takeaction, and I'll put that link in the chat box here in a minute, you guys will be prompted with a few actions, and one of them is this alert that's specific to the bill that John just described. You enter just your name, email address, your address, and then any other information, and it'll connect you to both of your senators and your representative in Congress with a pre-populated email just describing some of our specific concerns with the legislation and the importance of addressing the health center funding cliff. We always recommend that if you guys have personal anecdotes or a personal request or a reason for why you might want to include in that message, to please include that personal information. I think that always makes this type of communication more compelling and more convincing. But certainly if you choose to use what's pre-populated in the email box, that is good to go, and it should just take you guys a couple of minutes to take action. So please take a few minutes to do this and share this with your network, your colleagues, friends, family, anybody else who might be willing to take action on behalf of health centers.
All right. Thanks, Alex. And I want to move ahead. We have a lot of ground to cover even beyond what's going on with the bill. We're going to talk for a moment about the President's budget, and then we're going to get into sort of the 3 focus areas for health centers coming into the Policy and Issues Forum and into next week's call-in day, because even as all of this is moving forward, we are really committed to staying focused on the core principal priority issues that health centers are facing this year. A lot of it overlaps with what's going on with the bill, what's going on with the budget, what's going on with the overall congressional outlook, but we are going to talk in a little bit more depth just about each of those priorities and how they all fit in as we come to town next week. But before we do that, I want to introduce the newest member of our Federal Affairs team, Oliver Spurgeon, who's joined us just in the last month. Perfect timing, as there's nothing really going on, so he has plenty of time to get his feet under him. But he'll be handling our budget and appropriations portfolio on the Federal Affairs team going forward. And while we don't have a lot of detail about the President's budget, he'll share what we do have.
Thanks, John. So last Thursday, President Trump's administration put out their FY18 budget outline. And there's an old saying that says the presidential administration proposes a budget and then Congress disposes of the budget. And it seems as though this skinny budget hasn't really been well received by Congress with open arms. And that's in part due to some of the harsh cuts that were contained in the skinny budget. It's called a skinny budget because it's a framework of a more robust budget that many onlookers expect to arrive in mid-May. And so we don't have a lot of detail, as John said, but we do have some ideas about how this would affect community health centers. So there were some high points in the budget. The section on Health and Human Services was only 2 pages. And so some of the good things that we saw is that there were 2 discrete mentions of support for community health centers, which we thought was great. You can see them there outlined in the PowerPoint. But there was also some very good news on the workforce front as well. You know, we were excited to see that there was funding set aside for providers for health care and specifically for CHCs because of our support of low-income Americans. And so we were glad to see that. So as I said, we're waiting on more details in mid-May to see what the funding tables are going to be. This budget outline didn't really contain much information about how much was going to be allocated for community health centers, only that there were broad levels of support for health centers. On the bad side, though, as I said, the budget wasn't embraced very well by members of Congress, and that's because it contained some pretty harsh cuts across the federal government. And so as you can see, the Department of Health and Human Services, which provides a litany of programs that our patients use, was cut by 16%, by about $12.5 billion. And then the National Institutes of Health, which conducts detailed health research and was really funded through the Cures Act last year, was also cut by 18%. That's $5.8 billion. So despite the mentions of support for community health centers, we were really sad to see that there was sort of a broad swath of funding that was supposed to be cut from HHS. And we know that that money goes a long way to support the work that you all do and to really support our patients who visit CHCs every day.
Great. Thank you, Oliver. And I think, you know, the President's budget is just one more sort of piece in the narrative in a very confused year where we have not even finished last year's appropriations process. We're well underway for this year's. We'll talk about those letters shortly. And now this budget is sort of interjected into the middle of that, even as the healthcare debate is going on in parallel. So there are, by no means, there's a lot of balls in the air, but we're following all of those. And I think the overall takeaway that health centers have been stated now as a priority of the administration is a positive one. We're going to be focused, along with many, many other groups, in preventing some of the rest of those cuts. So I just want to return now, as a way of setting up where we go from here, to the 4 core areas that we've been focused on in each of the monthly webinars that we've held since the election. And those remain the same. The highest priority areas, really the 2 pillars that we've talked about for the whole year so far that hold up the health center program, are Medicaid and the future of health center grants. Then I think alongside those, really the priorities of the workforce issues, so critical to making sure that health centers can carry out their day-to-day business, as well as then the 340B program. As we go into the Policy and Issues Forum, we'll really be focused, I think, on the first 3 of those, Medicaid, health center grants, and workforce. That's not to say that we're not still paying close attention to 340B, but I think based on our intelligence, 340B is not as much of a front burner issue for Congress right now as some may have expected it would be at this point in the year. And so while we're still very engaged in that debate, we want to keep our message very focused going into the P&I. So those 3 areas really translate into the 3 NAC 2017 policy papers that you will have in your registration bags if you're coming to the P&I. We'll have on our website once the P&I kicks off, and we'll have more information about that later in the presentation. And these will be the sort of guiding policy documents intended to be really the foundation for our policy work for the year, but that folks will also be using in their Hill meetings going forward. So we want to walk through these one at a time, talk about some of what are the key points in them, how do they relate to what's going on more broadly right now, and then what are some advocacy tips that you can each do to get ready, whether you're coming here next week or whether you're going to participate in the call-in day. So we will start with Medicaid, and I'll turn it over to my colleague Jen Taylor, who handles Medicaid for our team.
Good afternoon, everyone. Happy to be with you today. I'm definitely going to take my best stab at talking you through Medicaid changes right now. I think John already really mentioned the big threats that are posed to Medicaid through the American Health Care Act as it's been currently proposed, particularly the rollback of Medicaid expansion and the changing of the structure to a per capita cap or a block grant proposal. You're going to not see those specific proposals included on our policy paper, and that's because this policy paper, as John said, is designed to be really more foundational about the importance of Medicaid to health centers broadly. And the other reality is, with such a quickly changing climate, as you can tell, we, need to keep a policy paper that helps you talk about the most important issues of Medicaid that isn't going to be able to change day to day depending on the whims of Congress and where they are at that point in the process. And so we're certainly happy to help continue to talk with you about questions you might have specific to proposals as they continue to evolve, and to help you think about how to use this paper if you are sitting down with a member of your Congress to be a little more tailored to a meeting you might be having. But I think you'll find this will be really useful in you addressing some of the major challenges that have been proposed, including a loss of coverage to patients and the need to maintain continuity of access to care. So certainly when it talks about, you know, a loss of Medicaid expansion dollars and a rollback, we have big concerns, as John said, that that would leave patients without adequate coverage. Certainly it would leave them in a bind about trying to access necessary specialty care services, even if they can still find their primary care with a health center. And we're further concerned from an access to care standpoint that you would leave health centers with less reimbursement over time, putting a bigger strain on our grant budgets, as we're seeing more and more uninsured and people losing their Medicaid coverage. And that's a real threat for health centers, ultimately having to close doors or make really difficult decisions about maintaining care for their patients. And so while you don't necessarily see a discussion of rollback of Medicaid expansion in this paper, I think you'll find the points we make about the importance of protecting coverage and protecting continuity of access to care will be really helpful for you in talking to any member of Congress. The other piece that you'll see on here, again, we don't speak specifically to a per capita cap. As John said, we are extremely concerned that a move to a per capita cap or a block grant environment in which states are receiving less funding overall will leave them with really tough decisions in the long run about cutting benefits, about cutting eligibility. Again, I think this paper can be really helpful for you making the arguments about why Medicaid works so well as it currently exists, and why we're concerned that any cuts to the program will leave us worse off than we are right now. The other piece I want to point out is there's a big focus on our Medicaid SQHC PPS within this paper. As John stated, and I apologize for the outside noise, welcome to Washington, D.C. As John stated, SQHC PPS is not explicitly changed in this bill, which is a good thing. We're glad to see, for the most part, it is maintained. We do have some concerns under a block grant scenario that it would ultimately be undermined, but it is not specifically changed in this bill as it stands, and so you may be wondering why then we're putting such a big emphasis on PPS within the policy paper. I think that's really important for a couple of reasons. One, even though PPS is not changed at this point, we still are concerned, as I said, about the long-term impact on health centers that these changes would pose. So if you're cutting funding to your state Medicaid program, you potentially leave any payment that's currently right now maintained, but as we know, is eligible to be waived in an 1115 waiver, or may stand out to a state who says, you know, I love my health centers, I would love to protect them, but I just have too few dollars to work with, and cuts have to come from somewhere, and everyone's going to have to kind of share that pain. In either of those scenarios, we are concerned that it would ultimately result in less funding for health centers and less access to care for our patients, and so we think it's really important that people understand the PPS, that they understand that Medicaid and health centers work really well together right now. And I would say, in addition to this sort of threat by waivers, we have heard, and I think John alluded to this, some concerns coming from Medicaid directors and a handful of Republican governors as of late about our PPS payment. Again, we were glad none of those changes were made into the bill, but I think it's going to be really important for all of us to really engage on an education effort to make sure people understand why the PPS is so important to health centers. And why Medicaid is one of the underpinnings of, you know, providing the services we provide. I think something I would say to you is I know it may seem a little bit scary or intimidating to have to enter into a Medicaid conversation when you may not have had one specifically with your members of Congress before. Certainly you may not have talked to them about PPS. We have some good resources to help you with that. I know Alex is going to talk through some of them. We also have a new one-pager on our PPS payment that might be helpful to you if you have questions, and we want to be a resource for you in that process. I think what I would want to emphasize with you is there's really nothing to be intimidated about. You don't have to worry about getting into a detailed explanation about every intricate way that the PPS works and the year it came into effect and how it was calculated for each health center. If you are able to deliver the message that health centers do have a unique payment that is designed to cover our comprehensive services, and that health centers work really well within Medicaid to provide access to care for our patients and deliver good value to the Medicaid program, that's a huge win. That is the message we need you to be able to carry so that members of Congress really understand the important relationship between health centers and Medicaid. The rest of the details, if you are comfortable with them, are great to layer in, but I think that foundational message is what we really need to carry, and that will be so helpful to us in the days ahead as we continue to navigate proposed changes to Medicaid. So again, I want to leave you with this. At the end of the day, you do not need to be afraid that you need to know every possible aspect of a Medicaid conversation. I'll be clear with you that the members of Congress and staff you are meeting with probably don't. And you really are the experts on Medicaid at your health centers and in your communities. You can tell stories firsthand of how it has changed people's lives, how you use it at your health center to provide access to care. All we need them to be able to do is to really connect those dots, that if they love their health center, they need to understand that Medicaid is really important to maintaining that health center in the future, and you will have delivered the best message you can possibly deliver, whether that's here at PNI or from home with your advocacy. So with that, I will kick it over to Alex, who can tell you a little bit more about some of the resources we have to help you tell that story.
Thanks so much, Jen. So one of the really coolest resources we have right now for telling your Medicaid story is the Medicaid Impact Statement tool, which is on our website, hcadvocacy.org/makethecase. That's where you'll find a bunch of resources on Medicaid and the CLIF and other ongoing action steps that we'll talk about a little bit later. But this tool is really helpful. You plug in some of the information about your health center in terms of the Medicaid patients you serve, and it produces this nice infographic for you that shows basically the impact of Medicaid at your health center and in your state. We think this is a really important tool that you can bring to the PNI if you're coming to meet with your members of Congress, but also if you're meeting with elected officials back home in your districts, or if you're meeting at a later point, we encourage you to fill out this tool. But going a step beyond this tool, we think it's really important, like Jen said, to think of a story or two that really highlights the importance of Medicaid to your center. Data is great, it's super important. We definitely encourage you to come prepared with the statistics that really highlight the importance of this program. But what is really compelling and really makes the case and persuades members of Congress to see things from our side is that human element. Those stories are incredibly important. So if you can think of a patient or two that you can get permission from them to tell their story about how Medicaid maybe has helped them get a service that they really needed and otherwise wouldn't be able to afford, how Medicaid has helped them have a continuum of care beyond just the services at the health center, but other specialty services that he or she needed, just to really, again, highlight that human element and be able to pair sort of the stories and the emotion with the data. With that combination, I think you guys will have super awesome meetings in the future.
Great. Thank you so much, Alex. And I think, you know, we'll have the same kind of tip, but I think whether it's about Medicaid or whether it's about the CLIF, telling that local story and really calculating as best you can some of the local impact of this is going to be the key to having an important and effective meeting with your members of Congress. So I will switch over now back to Oliver to talk about health center funding and the CLIF as we're going ahead. We've got some letters that are circulating right now, but we also have a looming deadline out there that we really need Congress to act well before. So, Oliver?
Sure. As Jen mentioned, Medicaid is important to our overall funding, but we've also got another bucket of funding that comes through Congress that funded the CHC fund, and that came through the ACA and then was extended for 2 years in MACRA. And so, as you guys know, we're facing a cliff at the end of the fiscal year. That's September 30th. And so we're working to get the word out on Capitol Hill in both committees that authorize and appropriate money to make sure that they understand the importance of funding community health centers and providing you all with reliable and dedicated streams of money so that you can continue providing access and quality access to patient care. And so right now, Representatives Green from Texas and Billy Rackus from Florida are leading a health center fund letter on our behalf, advocating and urging members of Congress to write a House Appropriations Subcommittee in support of funding health centers, providing dedicated funding to alleviate the health center funding cliff that looms at the end of September. And right now, we have 62 members who have signed 62 members of Congress, who have signed on to that letter. And you can find that list, as Alex said, at hcadvocacy.org. And so for those of you who go on and see that your member hasn't signed, we're depending on you all to call, text, tweet, and email, and galvanize support for them to sign on to these letters. As you guys know, it's very rare for members to come out and support initiatives of this nature. And what tends to happen is that health centers are one of the most positive and widely supported endeavors on Capitol Hill. And our letter is typically one of the most highly supported on Capitol Hill as well each year. And so last year we had roughly 370 supporters on Capitol Hill among the Senate and the House. And we want to try and top that number this year, but that won't happen without your work. So as long as you go on to hdadvocacy.org and write your member of Congress an email and tweet them and urge them to sign on, we can make sure that there's dedicated and reliable funding for the Health Center Fund before that cliff happens in September. And I'll turn it back over to you now, John.
Great. Thank you. Yeah, I think that, as always now with funding, we've really got that two-part ask. One is those letters to really shore up the appropriation side, and then asking folks to really address the cliff issue. Again, I think as we've said all along this year, we really anticipate that the cliff will be addressed alongside some other priorities that all expire at the same time, like CHIP, National Health Service Corps, and other things. But in this environment, we really have to raise the noise on that if Congress is going to take it up as a priority. So to talk about how to do that, back over to Alex with our advocacy tips.
Yeah, thanks so much, John and Oliver. And as sort of similar to the action alerts that we showed you guys a few slides ago on the HCA bill, we have a similar type of alert going on now for the Dear Colleague letters, again, at hdadvocacy.org/takeaction. This alert will allow you to email, tweet, Facebook, and or call your members of Congress, right now your representatives, to ask them to sign on to the 2017 Dear Colleague letters. Again, the message is pre-populated for all of these different modes of communication, but we always encourage you guys to add a personal element, an anecdote, a story, your own personal perspective, because it definitely makes those communications more compelling. We always get more people when we have an alert like this using email than Twitter or Facebook, and we really encourage you guys to use those modes of communication too. Actually, several studies have come out in DC that show that Twitter and Facebook too, but particularly Twitter, really gets the attention of a lot of these members of Congress. They tend to look at their feeds pretty regularly and kind of check out what people are saying. So it doesn't take necessarily quite as many communications on social media to make an impact as it may for email. So it really just takes a quick second. You enter again your email, your address, your zip code, be connected to your representative, and you can just click through and send pretty quickly these different types of communications. If you are entering your information and you're not seeing a representative pop up, we've gotten a few questions about this, it's probably because your representative has already signed the letter. So if you want to just confirm that, you can confirm on the list of signers, which is also at hdadvocacy.org/takeaction. So I definitely encourage you guys to do that. We haven't had a huge level of response yet on this particular action, and we'd like to see it a little bit higher. We have, as you guys know, a really awesome, huge, engaged network of over 100,000 advocates. So we really want to see people showing up the numbers. And it's been a little bit of a slow start. So anything that you guys can do to encourage your friends, family, colleagues to take action, and of course if you haven't already to take action, please do so as soon as you get a chance, because we want to move quickly and we want to get as many signers as possible. The second advocacy tip on this slide is to use the Funding Cliff Impact Estimator. This is similar to the Medicaid Impact Estimator, except this will show an estimate, again, of what would happen should the 70% funding cliff occur later this year at the local level. So again, you'll enter a little bit of information at your health center level, your revenue, the number of patients you serve, things like that, and it'll pop out in sort of a nice looking infographic like you guys can see here on the slide that show the potential impact. That is, again, just an estimate of what might happen should the 70% funding cliff occur. Again, this is an awesome tool for you guys to bring with your meetings with members of Congress, your elected officials, whether you're coming to PNI or not. I really encourage you guys to fill out this tool as soon as you get a chance, take a look at it, and then think of a story or two that really highlights the importance of 330 funding to your health center. Again, the combination of the human element and the data is really what makes an impact here. So this gives you a relatively simple way to construct a good data source. And then if you compare it with sort of the story, the human side of those numbers, that is always more effective.
Great. Thank you so much, Alex. I couldn't agree with that more. I think that taking some of the national figures, which can turn pretty abstract for a member of Congress, we know at the national level, HHS has projected that if it's allowed to happen, the funding cliff would mean loss of access to care for 9 million people, a loss of 51,000 jobs at health centers, and closure of almost 2,800 health center sites. Those numbers are so big and so sort of abstract that they're just sort of going to bounce off your member of Congress and not make the impact, I think, that we would hope. What's really critical is to translate those numbers down into exactly what they would mean at your health center, for your patients, for your employees, for your number of sites. And I think what we've tried to do is put a tool in place that can help you along the way towards really making some of those projections and those estimates. So please take advantage of that. Do those calculations ahead of time if you're coming to town next week or you're planning to call into your member next week. That's one less thing you'll have to worry about as you're getting ready for those conversations, and then you can really build out your story around it. So I want to talk about the last sort of plank and policy paper that we're focused on this year. As most of you know, we have really been focused on the workforce issues over the last couple of years, really in response to hearing from so many health centers what a challenge they're having, both in terms of recruiting and retaining, but also participating in the training of the next generation of the health center clinical workforce. And we know that the workforce issues go well beyond the clinical workforce, also over into the administrative side and the C-suite and beyond. But we will be having a critical, focus this year on the primary care clinical workforce issues, and in particular 2 programs that are set to expire alongside health center funding this September. So first, we're going to focus on the National Health Service Corps, which really is a critical tool, as almost any health center can tell us, and does tell us all the time, for creating an incentive for providers to go work and practice in underserved areas. And then second, we're going to focus on the Teaching Health Center's Graduate Medical Education Program, another program started by the ACA, extended under MACRA, that is really a promising model for the future to bring residency training into community-based settings like health centers so that we train people up where we want them to practice, and we have much greater success. The data shows that people end up staying in those areas far past the time of that commitment. So both funding for both of those programs, all funding for both of those programs is also set to expire this year. That's why we're focused in particular on those 2. There are many other critical workforce programs that we follow, but in terms of an ask, we're focused on these 2 programs and the need to continue funding them into the future. So that kind of rounds out the policy papers. I do want to get back over to Alex for a workforce advocacy tip, and then we'll move on from there.
Thanks, John, and we don't necessarily have a handy-dandy calculator for this tip, but this is where I think it's really important that you guys think very specifically at your health center what your particular workforce vacancies or challenges are. What are your longest-running vacancies? What are your biggest needs? I think those particular questions are really important ones to consider. And then we really encourage you guys to frame the issue in terms of what more you could do should those vacancies be filled, as opposed to sort of the more negative side, sort of the current situation and the challenges you're facing. So if you can talk about like new services that you could provide if you filled those vacancies, or an additional number of patients that you could serve, or maybe you could, extend your hours or be open later certain nights of the week. Provide specific examples of the extended services and extended capacity that you would have if those vacancies were filled. I think that's really important. And of course, it's important to also just be prepared before you meet with your elected officials, particularly if you're coming to P&I, to know your specific situation with regard to the National Health Service Corps and the Teaching Health Centers program. Does your center participate in those programs? What are some success stories from those programs? Just come armed with as much information, and again, focusing on the positive, how those programs have really benefited your health center, and what more you could be doing should you have some of your workforce challenges alleviated.
Great. Thank you, Alex, and thank you for each of those advocacy tips. I just want to give Alex, Amanda, Dorian, Elizabeth, and the advocacy team a huge shout-out, because I think our goal here on the federal affairs side is to make sure you have the content you need, some of the background information, and most up-to-date, and they have really been backing us up on that with these critical tools and the messaging guidance, the talking points, all of that, and not to mention the incredible new website, hcadvocacy.org, where you can find all of this in a very organized, very accessible, very useful way. So thank you so much, Alex, for that. We have a couple of closing points that we want to make on the policy side, and then we'll go into a few more advocacy steps that folks can take. Whether or not you're coming to DC next week, as I've said already, our commitment to you is to make sure that you have up-to-the-minute information, talking points, background, and the rest as you are coming to the Hill, as you're working on administration meetings and other things. We've heard from a handful of health centers who've got meetings coming up through other organizations with Secretary Price and others. We really appreciate you reaching out, and we are here to help. Come to us with questions, concerns, to discuss how best to frame these issues in the political context. We know that the debate on Capitol Hill is very hot right now. There is a lot of partisanship, a lot of division, and these issues are proving very, very divisive. And yet, health centers have an enormous opportunity, I think, as one of the only programs, one of the only areas, frankly, of all of healthcare policy or all of federal policy that is widely agreed upon, for which support is widely held across political parties. And so how do we leverage that and make sure that, policies that are being considered are really reflective of what we want to see, what our patients need, and what's going to help us do our jobs. To that point, no matter what's happening in the congressional debate, remember that you are the expert. You're the expert on how your health center works, whether you're a board member, a CEO, a clinician, a staff member, just a community partner or other supporter. You know what your health center means in the community and what it means to the patients, and if you stay focused on how these issues affect that health center, those patients, and that community, you'll be fine in these conversations. What we have learned over the many years of doing this, and I think fair to say doing this successfully as a national movement, is that it's critically important to stay focused on the selective issues that we're putting forward here. It's not to say that if other issues come up in these meetings, it's not worth engaging in a dialogue. It's always important, if members are engaging you to get your opinion on anything, to give what your take is on a local issue, on a state issue, on another national issue that's not on our policy papers. But if you're coming all this way, or if you're taking the time to call in next Thursday, it's really critical to stay focused on these key priority areas that are health center specific, because nobody else is going to take up our mantle if we don't do it ourselves. Put it in local terms, and then be persistent in making sure you make the ask and doing the follow-up. So I'm starting to get over into the advocacy side of things, which is, how we roll over here. We all do all the jobs, but I'm going to turn it over now back to Amanda to talk through a couple more steps you can take. Luckily, she's in New Hampshire where there's not a background full of ambulances, so we're going to put ourselves on mute and turn it over to her.
Thanks, Don. You know what? I am really excited, actually, to turn it over to my team, who have done just a phenomenal job of preparing all the advocacy resources, creating this beautiful new site, populating it with the tools that you will need. And so I believe Elizabeth Kwasnick is going to take over for this portion of the presentation.
Thanks, Amanda. And good afternoon, everybody. Let us just jump right in here about the different actions that you can take and some of the things we've already gone over just as a review. Don't forget, next Thursday, mark your calendar. It's a call-in day. There's the number right there. We will have more information for you on the particular messaging and talking points closer to next Thursday, but get it on your calendar and encourage your colleagues, friends, and family to put it on their calendars too, so that we can really, really hit the hill hard with our phone calls and then with folks who will be in DC having those in-person meetings. Just another quick review of the 2 action alerts that Alex mentioned as part of the advocacy tips. We do have those live on our website. The first is to ask your member of Congress to support health center funding by signing the fiscal year 18 Dear Colleague letter. You can review a copy of the letter on our website as well as find out if your member has already signed. And then the second alert is to ask your members to strengthen Medicaid and prevent the health center funding cliff. You can see our statement on that legislation on the website and get a first look on the repeal and replace bill. And that's, again, hcadvocacy.org/takeaction. And then the other thing we want to talk about is the 3, sort of the menu of items, the 3 things you can be doing right now, aside from those action alerts, to be strengthening the network and making the case with advocacy. So the first one is create an advocacy plan. The second one is collect support letters from your state legislators. And the third one is to engage your network. And in the next couple of slides, I'm going to go into each of these in a little more detail. So the first, creating an an advocacy plan, that's really because we want you to be thoughtful about the who, what, where, when, why, how, all those things of advocacy and how you are planning to both build the infrastructure and then engage folks to act. Advocacy plans are part of the Advocacy Center of Excellence program that the Advocacy Department here runs. They're a model to institutionalize advocacy at your health center. And as part of the advocacy plan, we really encourage you to complete those 2 impact estimators that Alex talked about, the Medicaid impact estimator and the funding cliff impact estimator. So all of those templates and resources are available on the website. But really, really do think about putting an advocacy plan in place. It is never too early to do those kinds of activities. We obviously have our alerts out right now, so now is the time to activate your folks and to get this plan in place. The second item is collecting support letters from your state legislators. In some of our past campaigns and advocacy initiatives, we heard some great feedback that members of Congress really respond to local letters of support from state legislators and state representatives. So we're encouraging you to work with your primary care associations to collect these letters, make sure that everybody's on the same page and organized and there's no duplication of effort. And there are 2 versions of this letter that we have available on our website. We're looking for one of those versions to be directed from your state legislators to your governor to talk more about the state impact and some state-specific things. And then the other version is from your state legislators to your members of Congress. And again, sort of the same message, the impact on the state, but a slightly different messenger with the state legislators this time. So hopefully you can work with your primary care association. I know a lot of those folks have already sort of hit the ground running on this and are taking the lead, so be sure to connect with them on this particular effort. And the third, which is something we will always sort of have front of mind, is engage your network and spread the word. Some ideas for how to make this a little fun or create some kind of competition or to establish a recruitment goal and direct those advocates to take action. And we have resources on our website to help you with this. We've got sign-up sheets, both a digital version and a printout version if you're going to be out in the community and going to events. And then ways for you to share your story and encourage your network to share their story as well. We've got forms on our website where you can share that story with us. Sharing on social media is great, and I'm not going to go too far down that road because our social media guru, Dorian, is going to go through some of those steps. But really, the point of this action item is to let people know why you value your health center and why the health center is valuable to the community. So with that, I am going to turn it over to Dorian to talk a little bit more about some action steps.
Sure. Hi, everyone. This is Dorian Wanzer. So in terms of, thanks, Elizabeth, in terms of what individuals can do to take action and to get active in what we're trying to do, once again, you can ask your friends and family to take action. Definitely sign up as an advocate if you're not already signed up, but also take the time to recruit others. We encourage you to recruit at least 10 advocates if possible. And then also you can share your story or encourage others to share theirs. And there is a space on our website for you to be able to do that. Also, just if you look to the right of the screen, you'll see something called a personal tracking link. If you are active on our website and you use that link, and let's say you paste it somewhere and somebody clicks on it and visits HC Advocacy and signs up, then they will be notified, I guess, as somebody who you've recruited. So definitely use that if you're planning to recruit people online, because we'll be able to keep track of that and see how many people that you've welcomed to our site. So definitely take advantage of that. I'm going to switch slides here. So I'm sure as many of you have seen, there have been plenty of tweets and Facebook posts with the hashtag #ValueCHCs. It is a social media campaign that we have introduced. It's really for advocates who are going to be back at home during the P&I, a way for them to engage with their legislators online. As Alex said, many legislators look to get constituent opinions and updates and feedback from social media. So for them to be able to see a wave of people who all value CHCs by sharing pictures and GIFs and videos and special posts is really pretty remarkable. And right now we've already hit over 500,000 impressions using the hashtag on social media. So I definitely encourage everybody to keep it up. It's very simple to participate. You don't have to do it this way, but if you would like, you can take a photo, you can share a photo of a health center experience, maybe you at your health center. You can post it on either Twitter or Facebook, and then you can use the hashtag #ValueCHCs, you know, something like I value CHCs because of X, or we value CHCs. So just get creative with it, but definitely participate. It's really growing. Moving on, in terms of resources for advocates, once again, our new website is really great. It's mobile friendly, so you can access resources either on your laptop, desktop, or on your phone. It makes it very easy to recruit advocates as well. You can do that by sharing, once again, sharing your recruiting link. You can recruit advocates via email. You can also share content from the site on social media very easily. But in terms of advocacy before the P&I and during the P&I and after, we've had a bunch of these webinars. You can access those on our website by going to past advocacy events. You can access talking points, PPS fact sheets, Medicaid savings study. You can also look at the funding cliff and Medicaid impact estimators. And then, obviously, what's most important are those links to take action and spread the word, and then, of course, the P&I policy papers. So all of that information can be found in two places, hcadvocacy.org/make-the-case or hcadvocacy.org/Hill Day 2017. And if you can't find something, you can search the website, but also don't hesitate to reach out to Federal Affairs or the advocacy team. And finally, it just obviously save the date for the P&I, which is coming up next week, March 29th through April 1st. We're looking forward to seeing you. Definitely attend the session at 12:30 on March 29th. It's entitled Be Ready to Head to the Hill. You'll get some great tips, and we've got a lot in store for you that day in terms of how to prepare for your visits to make them the best they can be. On Thursday, March 30th, we're going to be having a National Health Center Call-In Day. There will be information and talking points about that available on hcadvocacy.org coming soon. And then Also, next month, which will be here sooner than we know it, April 26th, it will be the next policy and advocacy update webinar. So mark your calendars for that. You can RSVP on our website. And then once again, just continue to participate in the Value CHE campaign. Now through April 7th is the time that we're really going to be looking at those individuals who have made really impactful statements online and are really getting a lot of buzz, and they'll be featured in a special way, but it's definitely a hashtag that's going to continue. So just, again, be creative, continue to use it, and let everyone know why you value CHCs. So I will click over. I guess I can pass it back to Amanda or John, but if there are any questions, type them in the chat box and we'll get to responding to those.
Thanks, Dorian. So I think we do have a couple of questions, and I'm going to ask Alex to help out in sort of fielding those appropriately. Before we dive in on that, I just want to pause for a second. There was a ton of information in that presentation, and I think if everyone on the webinar today feels anything like we feel on a day-to-day, it's easy to wrap up some of these conversations and just feel as though your head is spinning. It's a lot of information, it's constantly changing, and there's a lot of balls in the air. But I can say with absolute confidence that we have the absolute best federal affairs team working on behalf of health centers on the Hill. Every single action that we take is with the very best interest of the health center program and our patients at hand. And our advocacy strategy, without bragging, has been very successful, and that's because of everyone on the webinar today. That's because of our Health Center Advocacy Network. We are now approaching 130,000 people all in. We've got almost 110,000 proper in our advocacy database, and when you take into account the reach of our social media accounts, it's almost 130,000 people. That is a hugely impactful voice on behalf of America's health centers. But I tell you what, one does not function without the other, and the power and the effectiveness of the health center voice is because of our federal affairs team and the incredible staff at NAC working hard to deliver the message every day on the Hill, and because our members of Congress, our governors, our state legislators, and everybody else is hearing the health center message directly from advocates back home on the ground who can tell that local story, who can explain what the policy proposals actually mean in terms of human impact. So a big thank you to everybody for being on the webinar today, for taking the time to understand all of these complex issues and all of the number of challenges and opportunities we face, and also the critical action steps that we're asking you to take on the advocacy side. So with that, Alex, do we have some questions that we can take up and answer for folks?
Yeah, absolutely. We have quite a few. And just a reminder to you guys, please definitely share your questions in the chat box. If we don't get to all of them today, we will try to follow up with you guys individually. And of course, as always, don't hesitate to reach out to us. So one of the first questions I have here is about the 10 essential health benefits. Can you guys talk a little bit about how the 10 essential health benefits are going to be affected in the Republican proposal?
I'm going to go ahead and turn it over to Jen.
Thanks, Alex. That's a really good question. So actually, the 10 essential health benefits as mandated by the Affordable Care Act for the marketplace will still exist even under the repeal plan, and that's largely because of the rules of trying to pass a piece of legislation under reconciliation. As we've referenced, there's a lot of tricks about doing it. The upside of passing a bill this way is you only need 51 votes, but the downside is you can't necessarily include all the things you would otherwise like to include. And in this case, while Republican leadership and several individual Republican members of the House and Senate have long said that the essential health benefits are problematic in their eyes and they would like to remove them, they cannot do that under this piece of legislation because it does not specifically have an impact on the budget, and therefore it's not eligible to be included in the bill. So what we're seeing in this proposal is it maintains the essential health benefits in private plans. It does remove essential health benefits requirements within Medicaid as of 2019, but you would still see those 10 categories maintained in private insurance. I will say I would expect to see down the line additional efforts to address essential health benefits. We have heard certainly the administration is interested in looking at flexibility. Those 10 defined categories are protected by law and would need a bill to change them, but there are some requirements such as covering birth control with no copays That, for instance, was done through regulatory action and could be on the table for changes in the future. Also further would expect to see legislation trying to address the 10 essential health benefits that are mandated by law. That would be in a bill that requires 60 votes in the Senate, and at this point in time, I think it is unlikely you would see passage of such a bill, but that is something I would expect to see people pushing for in the future.
Great, thank you. And I've got another question here. Somebody who's saying that their representative doesn't really believe that there will be a reduction in coverage, at least not for people who want it through this AHCA proposal. Are there any tips that you guys have on convincing this person's representative that the legislation as written will most likely result in low-income patients losing coverage?
Sure, and thank you for that. I know that that must be a frustrating situation to be in. You know, I think a couple of things. Number one, the CBO estimate is right now sort of being held up as the gold standard in terms of what the overall impact of the bill will be. And yet I think there have been some efforts on the part of both the House leadership and the White House to sort of preemptively discredit CBO and say that they didn't get the estimates right on the ACA, which is true to a certain extent. I think the best thing to do, you know, if you have a member who is unwilling to believe that a bill that reduces funding for Medicaid by $880 billion over 10 years would not lead to people losing that Medicaid coverage. I mean, I think health centers are in a unique position to speak to exactly how fragile the coverage that their patients have is on a day-to-day basis. And so, you know, I think you could take that down into very specific patient terms of even when the Medicaid program is in a relatively stable place, patients churn on and off of coverage consistently. There are state policies in many cases that have people locked out of coverage if you lose that coverage for a certain period of time. So even in an environment like we have today, any small tweak to Medicaid, especially, as well as to the private funding under the exchanges, could make a very, very different, you know, scenario for our patients. Add to that the fact that you're taking an enormous amount of resources, at least according to the CBO projections, which again are nonpartisan, out of the system, and it's very, very difficult to envision how those changes don't lead to, as we said, cuts to eligibility, cuts to benefits that are covered, or cuts to payments. And I think each of those things really gets in the way of patient access to care, whether they're, you know, folks are no longer eligible for coverage. Obviously, that presents a major barrier. If certain benefits aren't covered, health centers are either going to have to pick up those things through grant funding, or patients simply aren't going to have access to those benefits. And by the same token, if provider payments are reduced, you know, it's just going to undercut the overall capacity and viability of our health centers to really, you know, continue to provide the care they're providing. So I would step away from the national numbers because obviously they've seen them, and if they're not convinced by those numbers, you're not going to change them. But I would take it down to the budgetary impact. If your health center lost 10%, lost 20% of Medicaid funding, if you lost 70% of grant funding, what would that be? What would that mean in terms of what your patients would face in terms of a lack of access? I think that's the best approach.
Great, thanks so much. And I have a question here about regarding advocacy specifically. This person asked, how important is it for you and other supporters from your health center to email and otherwise reach out to members of Congress who already know and support your issues, and how should your message to these supporters be different?
I think I will take a stab at that, and then it may be that John and his team have additional comments, given that each and every one of them worked on the Hill for some period of time, so they may have some personal experience with this. I think the first part is, yes, 100%, it is still important for those offices to hear from you. the best way to start is by saying thank you so much. We appreciate your support. We know that you understand the importance of health centers. We just wanted to be in touch because this is such an important issue, and we want you to understand the specifics of how this will impact our health center. You can reinforce and even say, we have no doubt that you support us and we're so grateful, but it is still important that they hear from you. And there's a couple of reasons for that. For one thing, right now, the level of communication going into every single office is through the roof. Many of these offices, both supportive and not necessarily so supportive, are counting the number of communications and points of contact in any particular direction. So right now, part of it really is a numbers game, and I think it is important to make sure that we weigh in and represent health centers as a part of that in the big picture. The other thing is you can't take anything for granted. They may be supportive, and that's wonderful, but I think it is ill-advised to make the assumption that they understand the uniqueness of how this may or may not impact health centers. And you never know how your advocacy is going to translate. You never know the conversations that they are having with colleagues across the aisle, or someone who's not sure, or someone who's taking a beating in their district for voting in a particular way or leaning in a particular way. And it may just be that your story, your advocacy, is what tips the balance in the direction that we want. So always, always, even in the case of supportive offices, it is critical to continue to weigh in. But I think it is also important to recognize where you have existing support and let them know that you're not at all trying to browbeat them. You simply want to make sure that you're connecting the dots on the specifics for health centers and our patients. John and Jen, anybody else have anything else?
Oliver had a thought.
I was going to say that's a great segue, Amanda. You know, one of the things that I learned on the Hill was that repeated contact matters. And so there were times when we knew that health centers were in favor of a bill that we were supporting, but we still needed to hear from them day in and day out because everyone else was lobbying on that bill. So you've got farmers going up to the Hill, and you've got health centers, and you've got doctors, and you've got hospitals. And so you want to make sure that our broader message, that health center funding is important and that we're providing quality and critical care to communities that would otherwise go underserved, that message breaks through on the Hill. And so you have to have those repeated contacts over and over and over again. And so one of the things that I will leave you with is that for those of you who have already signed up and urge your member to advocate and sign on to the Health Center Appropriations Fund letter, follow up with a thank you. Tweet at them, call them, email them, and say thank you for doing great work on behalf of health centers. That goes a long way in terms of cementing relationships and also ensuring that when they have a question about policy in the future, they think of you as local resources for information and for advocacy. And one thing in terms of broader strategy as well, as Amanda said, there are certain offices that catalog the number of people who reach out on behalf of a certain issue. For parties that are trying to determine how much broad support there is for passing a bill or for opposing a bill, they look at these broad statistics and they say, you know, we've had contact from roughly 10,000 health centers or from 9,600 hospitals or whatever, and use that as a metric for saying how much support there is for a given issue. So we want to make sure that health centers in every congressional district and in every state are advocating on behalf of our issues to make sure that we have reliable and dedicated funding.
Thank you both. So I've got another question here regarding our policy priorities coming up for the P&I. Can you all clarify your thinking on why and whether or not 340B is not in a currently threatened space and why it's not on the policy priorities for the P&I?
Sure. I'll let Michaela Keller on our team speak to that. She's living 340B day in and day out, and then happy to sort of jump in as well.
Sure, yeah, great question. So to date, we have not seen any legislation introduced in Congress. I think, as many of you may know, over the past couple of years, there has been a big push by the drug manufacturers to introduce some form of legislation to make some changes to the program. We haven't seen that, but as John mentioned earlier, we have been keeping in very close contact with staff on the Hill, including in the key committees of jurisdiction, and certainly they have a lot on their plate right now, and so I'd be remiss if I didn't say that we could potentially see something, but certainly at this point the focus on the 3 policy papers and those priority areas are sort of the focus we want to have going into the conference next week.
Yeah, I think the only thing I'd add is I think that's exactly right. We're in a place where on the 3 issues that we've highlighted, there's either a bill under discussion or a funding stream that runs out in a matter of months. And so the urgency of those three is really what has brought them to the front burner. We know that there's a discussion about changes to 340B. We know that we may be seeing some legislation, as Michaela said, later in the year, and it's important that health centers be an active part of that conversation. But we also think we're pretty well positioned within that debate, and that most policymakers typically hold up health centers as one of the real examples of how 340B should work. So we're trying to keep it very focused on the most urgent and most high-tier, high-priority issues.
Awesome. Thank you both. So can you talk just quickly about, even though it's a complicated topic, about how states could potentially waive health center PPS through block grants and kind of our strategy for protecting PPS in a block grant environment?
Do you want to start, Jen? Or I can start.
Sure. So this is a question we get a lot, and I think there is a lot of confusion about how a waiver has worked and could work. And we actually just recently did a really in-depth look at this from a state perspective with a webinar we did here in-house, and we've got some resources we could share with you if you really want to dig into this more. I think what I would flag is that states can file an 1115 waiver with CMS to say that they would like to make changes or improvements to the Medicaid program. It can waive any portion of the section of the statute that includes our PPS. So it's Section 1902, which is the Medicaid statute. Any of that can be waived in a waiver. So that's something that was always true before this bill came to be and before we had this election and this Congress in power. What we have seen in past years is as people have discussed the possibility of waiving PPS in recent years or putting that in a proposal, that was not something the most recent administration was inclined to do. And a lot of states, for various reasons, may have backed down from doing that. We did not see one recently proposed, nor would we have seen it approved. We think that that environment has changed significantly. We are hearing from the HHS Secretary Price and the CMS Administrator, Seema Verma, that they are really looking to create an environment of maximum flexibility for states to be able to run their Medicaid programs however they should see fit with as minimal federal restraint or constraints as possible. And so certainly in that kind of environment, combined with the fact that we're seeing potentially less dollars going into the program should these changes from Congress go into effect, really we think puts us a bit in the crosshairs in terms of PPS potentially being included in a state waiver proposal moving ahead. There's still a lot we can do here to work with governors, to work with Medicaid directors, to work with stakeholder partners in those states should we see such a proposal. We know we've talked with many of you probably who are on this webinar who have either talked with their Medicaid directors about those concerns, who have heard from their governors who had questions, and we've seen that education effort really be able to sort of turn back proposals that may be critical of PPS, but that possibility remains, and this is why we're really working closely with our state affairs department. This is going to be kind of a full court press to really make sure that everyone from a member of Congress to a governor to a Medicaid director to key stakeholder partners in health center communities really understand what the PPS is and why it works so well, so that we have the opportunity to really try to prevent bad changes from being proposed in the first place, and should they find their way into a waiver, to really try to work with our states to educate them about what the potential downside would and to try to turn those back before they get to the point of being submitted to CMS, where, again, we are very concerned, not because CMS is out to get health centers by any means, but because they are taking this broad brush approach to flexibility that it will be hard to pull things back out from CMS at that point in time. And John, anything you want to add to that?
So I think that the only thing I would add is that I think that as we look at the legislation that's in front of us, not under the per capita cap, that's a change to the financing structure really only of Medicaid and doesn't really change anything regarding what Jen's been describing. And so those threats have been out there, they remain out there, and they're more about the interaction between states and the administration. Under a block grant, I do think we're concerned that states would have sort of blanket flexibility or what people are describing as a global waiver to really start from scratch in terms of designing their programs, and that they would not necessarily have to single out something like health center PPS as something that they wanted to get rid of, but rather could just rebuild an entirely separate program that looks very different. That's in part the difference in our concerns over a cap and a block grant. That being said, I think we are relatively confident that the block grant proposal is likely to face some major headwinds when the bill goes to the Senate, and so we're paying close attention to that. But I think that that's another area of concern.
And I think all of that underscores why, in addition to all the advocacy work we're going to ask from you, towards Congress and working with us, I think it's going to be more important than ever this year that you think about how to tailor your advocacy efforts to working with your state legislators, your state Medicaid directors, your governor, and again, key stakeholders in your communities. I think these efforts are really going to go hand in hand more than they ever have before, and that, what happens in one state is going to have an impact on the rest of the country, and vice versa. The policy here is going to have an impact on the state. So it's great that you're thinking through that lens, and please keep working with us on ways we can help, tailor your advocacy to your state.
Great, thank you all. And regarding sort of preparation for the P&I and potential changes with the AHCA this week, since the House is expected to vote on that legislation this week, is there a contingency plan for discussions with House members during the P&I if this passes?
I think it's a great question, and it's one we're continuing to pay close attention to and wrestle with here. I think what I can say, and I've been saying this all week, is the only thing I can guarantee you about a healthcare policy that's happening today is that everything will have changed during this webinar. And so when we go back to our emails, the environment will be different, the legislation will be changing, everything is in more or less a constant state of flux. And so our commitment to you, and this includes up to and including, the day before you go up to the Hill, is that we will be tweaking the message, tweaking the background updates, giving you all the information you need about where things stand in both House and Senate, and then doing some real targeted work with individual health centers and individual primary care associations where we know that they have House members or senators who are right in the middle of these conversations to really tailor that message. But, I think at the same time, that's why we do the policy papers, is that they are really evergreen in a certain sense. They're meant to be sort of the foundational arguments that we are up there making on behalf of health centers regardless of what's being, deliberated, discussed, voted on, passed, or changed at any given moment. And so I'll just plug a couple of things because if you are coming to the P&I, we have the pre-Hill Day session. It's on your screens now. That's really one of the last moments that we'll be doing an in-depth update for folks on all of the messaging. That's from 12:30 to 2:45 on Wednesday. Right after that, we'll be doing the opening general session where we will again sort of be presenting the policy agenda and the asks going up to the Hill. Your state delegation meetings are right after that session in the 5:30 to 7:30 hour. And so each of those three places is really a good opportunity for you to kind of make sure the message is tight, get up to speed on the latest developments. We'll be there to sort of guide that along. But absolutely, we're planning to respond to events as they occur and as we're able to shape them to the extent we are. And we'll have the most up-to-date information and the most up-to-date messages when we get there next week.
All right, guys, this is Amanda. It is 5 o'clock on the nose, and we do want to be really respectful to folks in terms of their time. We're so appreciative that you joined us today to get the latest in terms of what's happening in Washington, how that affects you back home, a little bit on, of course, what's happening in state capitals with your governors, your state legislators, and a whole gamut of other things, including those really, really important advocacy action steps that we would ask each of you to take immediately following this webinar. If you do have questions that we did not have a chance to get to, you can enter them into the chat box now. If you've already done so, we'll make sure that we follow up with you directly. Again, thank you so much for joining us today. For those of you that are not going to be in Washington for the Policy and Issues Forum next week, I just want to say again, your voice and your role as advocates back home is so critically important to echo the message from at your health center on Thursday as a part of that call-in day. So please make sure that you put a plan in place to make sure that you're activating your entire advocacy network. We will get you the message, the script, and the talking points, all of the phone numbers, everything you need to be a successful advocate that day and really for all of the weeks and the months ahead. So thanks again, everybody. Have a great night, and we'll look forward to talking to you again very soon. Take care.